Welcome. This is a presentation for understanding models of disability. I initially gave this presentation as part of a teach-in, but a lot of people weren't able to make it, so I decided I would record it to make it more accessible and available to more people. So what is this presentation about? This presentation will talk about what is a disability and models of disability. That's how we understand who is disabled and what that means. And we'll talk about the medical model and its criticisms, people who have opposed the medical model, the universal model, and why in the US we don't use this model, the social model and some of its features, the tragedy model, a history of eugenics in the US, the identity model, and identity and disability culture. What is a model for disability? A model for disability is a mode of defining and understanding disability. Each model entails different ways of thinking about the experience of being disabled as well as the people who are disabled. Why learn about this? Why did I take all of this time and energy to put together this entire presentation and record it to make it available to people? Well, the ways we think about disability have implications for disabled people. Understanding these implications can make you a better citizen. Knowledge is power, so being able to understand the way you think and the implications can help you do it in a better way. So what are the models of disability? And I'm going to talk more about each of these in a great detail, so I'm not going to read off of the slides here. But the models that we are going to use are the medical model, the social model, the tragedy/charity model, the identity model, and the universal model. The medical model. The medical model sees disability as a health problem that needs medical attention to be fixed. And there's an image here of 3 surgeons performing a surgery. This model is the most prevalent in Western society. This model does not see a difference between disability and impairment, and I'll explain what that means in the next slide. This model seeks to cure a person of their impairment. Within this model, if a person cannot be cured, they require medical attention to care for and manage their symptoms. This model is individualistic, and it puts the responsibility of a person's disability on the disabled individual and their doctors. So what's the difference between a disability and impairment? An impairment is a problem or a limitation with a body part or a person's mental capacities. A disability is the functional limitation based on that impairment. So, for example, a person who has a broken arm, their impairment is that their arm is broken. Their disability includes what they cannot do with that arm. So maybe they can't write, they can't throw a ball, they can't drive. All of that would be their disability. The medical model is focused primarily on correcting the impairment. So what are some examples of this? The first example I have here is a person with poor vision, and there's an image of a pair of glasses. A person in a classroom who cannot see the blackboard is expected to go see an eye doctor and get glasses to be able to see it within the medical model. There are other solutions that are not covered by the medical model. For example, the teacher could write bigger, or they could be placed closer to the board in order to see better. But that's not covered by the medical model. The second example I have here is a person with an injury, and there's an image of an x-ray of a person's hand. A person who has injured their hand goes to a doctor to restore the functioning of their hand. Controversies and criticisms surrounding the medical model. First, I'm going to talk about some of the benefits of using the medical model. The medical model seeks to provide medicine to disabled people. This can be a useful framework for people whose disabilities are caused by health conditions that they want to change, such as an illness, an injury, or chronic pain. For example, a person who has broken their leg and wants to heal in order to walk again may think about their condition through the medical model, saying, "I need medical attention for my injury." Often for people with mental illnesses, thinking and talking about their disabilities within the medical model can be helpful to them, as it can give their struggles a sense of legitimacy and make it easier for them to seek support. Many people have criticized why they would need to seek that sense of legitimacy and why all struggles are not considered legitimate, but it can help in individual cases. So, some of the criticisms. First, I'm going to talk about the anti-colonialist, anti-eugenicist criticisms of the medical model. The idea that disabled people should be fixed implies that it is better to be non-disabled than to be disabled, and this has eugenicist implications. The medical model implies an imaginary, non-disabled, healthy individual, which the medical model seeks to make people resemble. Our idea of a non-disabled, healthy person, and thus what the medical model seeks to make people resemble, is created within a capitalist colonial society that demands that people be able to work, prioritizes fertile heterosexual families, privileges white cultures and traits, enforces gender conformity. These social conditions shape what our medical model's non-disabled ideal looks like. The medical model does not take these social factors into account, nor does it address them. Controversies continued. So here are some of the anti-capitalist criticisms of the medical model. In a capitalist society where people are expected to work or starve, that prizes productivity, fixing a disabled person's condition might prioritize their ability to work and conform to socially acceptable norms over their happiness and quality of life. We'll talk about this in a future slide when we talk about ABA and conversion therapy. In a capitalist society, it can also be profitable to make something into a disease so that you can sell a cure or treatments. This model is individualistic, and it places the responsibility for disability on individuals and their doctors. As a result, it often fails to take larger social issues into account, and it fails to see them on a larger social scale. A case study for people who have challenged the medical model. Gay people. And there's an image here of a pride flag flying in the wind. In the DSM-1, homosexuality was classified as a sociopathic personality disturbance. In the DSM-2, it was considered a sexual deviation. Following the Stonewall riots, gay rights activists challenged the idea that homosexuality was an illness, and in 1970 and 1971, they interrupted the annual APA meetings. APA is the American Psychological Association. In 1973, the APA Board of Trustees voted to remove homosexuality from the DSM. Because of this, the APA had to redefine what a psychological illness was, and they decided that a psychological disorder regularly caused subjective distress or were associated with generalized impairment in social effectiveness and functioning. And that's a quote from Spitzer R.L., The Diagnostic Status of Homosexuality in the DSM, a reformulation of issues. So in this example, gay people were able to actually cause the medical model to change what it defined as an illness. Up until that point, homosexuality was described as an illness. But gay people were actually able to push back on that and make the APA reconsider what they considered to be an illness. Autistic people. We also have a pride flag, and there's an image right there of our pride flag. The treatment of gay people and the treatment of autistic people by the medical model are very similar. Many autistic people, especially children, are prescribed treatments such as ABA that try to make them behave less autistic, which is supposed to fix them in much the same way that gay people were and still are prescribed conversion therapies intended to make them less gay. ABA was developed by Dr. Ole Ivar Lovas, who used his techniques in gay conversion therapy to treat, and this is a quote, sex role deviant behaviors in a male child, unquote, in order to prevent him from growing up to be gay or otherwise gender nonconforming. This boy would eventually commit suicide, as do many gay people who undergo conversion therapy. Many autistic people have spoken out against this practice being used against them, just as gay people have, because we also have traumas from this. We do not feel that we benefit from it. Today, it is generally accepted within the medical community that using these methods to treat homosexuality is harmful because homosexuality is no longer considered a disease. But it is still a common treatment for autistic children. And the pushback still continues. In contrast with the medical model, I'm going to talk about the universal model. The universal model sees variations in our abilities as a natural result of human diversity. Within this model, all people are considered disabled because all people have some sort of limitation in their ability. The universal model. Unlike in the medical model, unique physical and mental limitations are seen as a normal, healthy part of life. Conditions including being young, giving birth, and getting old can all limit people's abilities. Everyone has something that they cannot do or they cannot do very well. Within this model, all people are disabled except for omnipotent beings. This model posits that society should create structures that accommodate the full diversity of human needs. This way of thinking about disability is very different from how many bureaucratic structures in the US view disability. Here is an example. There's a photo right here of an elevator with a sign on it that says, "For ADA use only. Please contact the building manager before using." And there's a phone number to contact. The photo here is of an elevator designated for ADA use only, meaning that only people who can prove that they have a disability and provide documentation for it are able to use this elevator. Within the universal model, anyone who would benefit from the use of the elevator should be able to use it. That could be anyone from somebody who just did leg day and their legs are sore, to someone with carrying a heavy box, to a parent pushing a stroller, to a person on crutches, to a person using a wheelchair. All of those people would be able to use this and they wouldn't have to provide documentation. And there are some consequences of not thinking in this way. The requirement that people prove their disability before they are allowed access to an accommodation puts an unnecessary burden on disabled people. People who have undocumented or undocumentable disabilities are most hurt by this. This includes people who have conditions that are difficult to document and people who don't have health care and can't go to a doctor to get a diagnosis. Why don't we use this model then? A large reason in the US is structural ableism under capitalism. Accommodating all people is very expensive. Our society is hyper-individualistic and demands that people support themselves in order to live, rather than supporting each other. Our society is very reluctant to give handouts. If you're familiar with stereotypes about welfare queens, you'll probably be very aware of this. So when a person asks for help, they have to prove that they truly, quote unquote, deserve it in order to get that help. Our culture values the hard work of an individual to overcome obstacles over creating an environment that supports all people and removing those obstacles. Criticisms of the universal model. The major criticism is infeasibility. It is often not possible to accommodate everyone's needs. People often have needs that we cannot predict. Sometimes people have needs that are incompatible. For example, a person with an attention disorder, like ADHD, may be distracted by subtitles, which are an accommodation to people who have difficulty hearing or audio processing disorders. So if you're one of those groups of people and you're watching a movie with your friends who have another incompatible need, you would have to negotiate that with them. Trying to predict everyone's needs can stretch a person or organization too thin. Given limited resources, it may make sense to prioritize certain needs over others. There's an image here of a sign for a reserved parking space. That's a very good example. When everyone needs parking, we still reserve the closest spaces with space next to them for people with certain disabilities because they benefit from those spaces more than other people would. Moving on to the social model of disability. The social model is very similar to the universal model, but with a few caveats. The social model views disability as caused by society. People with disabilities are viewed as a minority group who face structural oppression. For example, a poor building design can exclude people with disabilities, and that can isolate them from their communities. So what does this mean? All people have limited abilities, but our society is built to accommodate the limitations of some people, but not others. For example, the majority of people do not have good enough night vision to drive in the dark without additional lighting. Cars are required to have headlights that accommodate many people's limited night vision. There's an image here of a pair of headlights in the dark. You can actually get a ticket for not using those lights. A person who is disabled within this model has a limitation that is not automatically accommodated for, and it requires a special accommodation that is not already in place. For example, a person whose night vision is not good enough to drive in the dark, even with the headlights on their car, would be considered disabled. So what are some other examples of this? A good example to understand the social model is of a baby who cannot walk, and there's an image of a baby. A baby who cannot walk is not considered disabled under the social model because society does not have structures that require them to walk on their own, and their needs are supported by the adults around them. However, an adult who cannot walk, there's an image here of a person in a wheelchair staring up a flight of stairs. An adult who cannot walk is considered disabled because our infrastructure is designed without them in mind. Their mobility needs are not supported by most building designs. Some features of this model. This model does not view disabled people as inferior to non-disabled people. This model does not view disability as an inherent trait, but rather as a social category. This model considers the social factors that affect a person's ability to navigate the world. Those factors are not considered in the medical model. Certain populations are better accommodated than others. Conditions outside of ability, including wealth, social status, race, and gender, all contribute to how well a person's needs are accommodated. For example, a person who has poor vision and has vision insurance is going to be better accommodated than a person who has poor vision who doesn't have vision insurance. Within this model, a person can become less disabled as accommodations to their needs become more available and more commonplace. A great example of this is a person who has a disability that prevents them from driving. In an area that is not accessible by means other than a car, they would be a lot more disabled than they would be in a walkable city. And this begs the question, if a disability is due to a society's failure to accommodate a person's needs, couldn't any minority status be considered a disability within this model? And the answer is generally yes to this question, although we don't typically talk about it this way. A society can fail to accommodate a certain race or a certain gender, for example, of their needs for justice, access to housing, access to employment, etc. This can be caused by a number of factors, and if this sounds crazy, just remember there are social disabilities, including autism and other forms of neurodivergence, that primarily affect a person's ability to navigate the social world. What are some criticisms of this social model? The social model of disability sees society's attitudes and structures as the reason for disability. This can ignore the struggle with the impairment itself. For example, a person with chronic pain will struggle even when they benefit from social and structural accommodations. The charity/tragedy model. The charity/tragedy model sees disability as a tragedy and disabled people as the victims of unfortunate circumstance. Problems with the tragedy or charity model. It can be very dehumanizing to think of a person's everyday life as tragic. Especially for people with intellectual disabilities, it can be very infantilizing. Seeing disabled people as victims can be extremely disempowering. Many people who live with disability see their disabilities as just a part of life, and they don't see their whole lives as tragic. There are a few positives to using this model, however. There are times when acknowledging the unfortunateness of your circumstances can be validating, especially in cases where a person's disability is caused by health problems, especially as the result of injustice, including violence, pollution, lack of access to basic necessities, etc. Some people have disabilities that they would rather not have and would not wish on others. For example, I have PTSD and depression, and I don't typically see these things as neutral. This model can have a place in preventative medicine. For example, say that there's a disease going around that can cause people to acquire certain disabilities. Polio is a great example of this. It often makes sense to see this as a bad thing and put in place policies that would prevent people from catching this disease. In the case of polio, we created vaccines and we made them readily available. Some bad things that come out of the tragedy model. Eugenics. When disability is seen as a bad thing, people may want to prevent it by preventing people with disabilities, especially those that are caused by genetic conditions, from passing those genes onto their children. I'm going to talk briefly on the history of eugenics in the USA. This really barely even scratches the surface, but I think it's worth bringing up. The American eugenics movement started in the late 1800s and continued into the 20th century. A lot of the support for the eugenics movement was a backlash against desegregation by white supremacists. Most states in the USA had federally funded eugenics boards. Eugenicists saw sterilization as the most effective means to, quote, improve their population. The first sterilization law passed in 1907. It initially targeted men who were considered diseased, disabled, or mentally deficient. Throughout American history, forced sterilization primarily targets disabled women of color, especially indigenous women, and today it primarily targets immigrant women. Some forced sterilization laws in the USA. The court case Buck v. Bell in 1927 authorized forced sterilizations on people in mental institutions, and this ruling has never officially been overturned. The court case Skinner v. Oklahoma in 1942 recognized procreation as a civil right and rejected eugenics as a state goal. However, this has not stopped forced sterilizations from occurring. It only rejected it as a state goal. In 2017, a judge in Tennessee offered to reduce prison sentences to convicts who, quote, volunteered to be sterilized. I need to point out here that getting sterilized in exchange for a reduced prison sentence is not voluntary sterilization. Now that I've made everyone sad, I'm going to talk about one of the more positive models. The identity model. The identity model sees disability as a part of a person's identity, and here there is an image of a disability pride flag. The identity model is often considered a celebratory model. The identity model is seen as one of the most positive models because it celebrates disability as a part of a person's identity. The celebration of disability identity often allows people to feel greater self-acceptance and connect to larger disability communities. People who subscribe to this model may celebrate Disability Pride Month or hang disability pride flags like the one you saw on the previous slide. We celebrate Disability Pride Month in July. We celebrate our disabled identities, communities, and the pushes that we make towards social justice. Now I'm going to talk about a disability identity, and that is the deaf identity. Many people feel that they benefit from being deaf by being part of a rich deaf culture, especially those who are deaf early in life. Deaf people have their own rich cultures and languages that never would have developed in a world where everyone had perfect hearing. The two images that I've selected for this slide are images of two different sign languages. The first one that I've selected is the Arabic Sign Language alphabet, and the second one is of a person spelling out Filipino Sign Language in Filipino Sign Language. I've selected these images to showcase that there are many different sign languages, not just one. These are my sources. Recommended further reading. I've put together a list of further readings. The first is Out of the DSM, Depathologizing Homosexuality, which is about the history of the medicalization of homosexuality and the pushes back on that. The second piece of literature I've recommended is a book called The Spirit Catches You and You Fall Down by Fadiman. It largely talks about the failures of Western medicine when encountering people who have a different model for disease. It's a case study on a girl who has epilepsy. The next one is a TED Talk by Stella Young called I Am Not Your Inspiration, Thank You Very Much. And this is about inspiration porn. Inspiration porn is when people use disabled people to feel inspired. And in this video, she explains why she considers this exploitative. An earlier version of this presentation had 2 slides about inspiration porn, but it was getting too long, and I think Stella Young said everything that I said better, so I'm just going to recommend that you watch that. And my final recommendation is an article called America's Forgotten History of Forced Sterilizations. It goes into more detail about forced sterilizations in the USA. Thank you so much for watching and learning about disability with us.